Our guest on this episode first joined us almost 6 years ago, 300 episodes ago to be exact. So much has changed since then, and she returns to share updates and more of her journey with us today. You're listening to the PHEC podcast, episode 361. The field of public health is so broad, overlapping multiple industries. With epidemiology at the core of public health, there are an unlimited number of ways to target specific populations, health conditions, environmental issues, and causes that matter most to you. My name is Dr. Huntley, and I'm the host here on the Public Health Epidemiology Conversations podcast. I'm an epidemiologist, consultant, and entrepreneur with over 20 years of experience in healthcare and public health. On this podcast, my guests and I engage in conversations that demonstrate the importance of public health and epidemiology across a variety of industries, helping you think outside the box and inspire greater positive impact in communities around the world. Now, let's dive into the topic of this brand new episode. Greetings, everyone, and thank you for joining me on this episode. Whether this is your first time tuning in or you are a regular listener, I'm happy that you're here. I will briefly introduce myself or reintroduce myself and tell you a bit about what I do, and then I'll introduce our guests for this episode. Now, I lead a public health and epidemiology consulting firm that supports large nonprofit organizations and sometimes government agencies that serve Black, Indigenous, and people of color communities referred to as BIPOC communities. Now, we are often invited to support tribal organizations, and we're always honored to serve. We help our clients communicate their data and health information in plain language to the communities they serve. Now, this type of support helps to strengthen relationships, as you're all aware, between the organizations and the individuals within the communities. Some examples of the support that we provide include toolkits or fact sheets or customized reports, maybe like a disease report, community health profiles, as well as data-driven workshop facilitation that engages community leaders on specific disease and health-related topics that are most pressing within that community. So it really depends on the needs of the organization. If your organization serves BIPOC communities or is genuinely interested in building relationships with BIPOC communities, then please reach out to us. Our website is DrCHHuntley.com. There's a consulting tab from the menu. You can just fill out some basic information there. Let us know what your thoughts are or what your needs are. We'd be happy to meet with you and explore how we might be able to support your organization. We'll also provide links in the show notes to make it super easy for you. Now, on this episode, my guest is Misozi Houston, who was also our guest back in episode 61, which seemed like forever ago. That was exactly 300 episodes ago, or 300 weeks ago, back in 2018. And it does feel like a long time ago. We will provide links to that episode on the show notes page in case you'd like to check it out as well. Over the years, Misozi and I have kept in touch across LinkedIn, as well as we've seen each other in person at several conferences between, 2018 and now. I'm excited to have her return back to the podcast to share more of her journey on this episode with all of you. Let me formally introduce her, and then I'll connect our conversation. Misozi Houston is a health education specialist with over 5 years of nonprofit and public health experience. She is currently the Credentialing Project Specialist at the National Commission for Health Education Credentialing, also known as MPH. In this role, she leads projects related to credentialing, including job task analyses and maintaining accreditation standards. Most recently, she was the commission specialist at MPH before moving into her current role. Prior to MPH, she worked as a program manager at a local United Way. While at United Way, she supervised and led vaccine outreach efforts during the pandemic and volunteered as health chair and secretary for the local chapter of the NAACP. In these various roles, she utilized her passion for health equity and communication skills to plan, implement, and evaluate programs that included bridging access to health and community resources, including managing grants and engaging with stakeholders at local and state levels. Before a career in public health, she was a campus liaison for the American Public Health Association and faculty liaison for the student group Community Health Organization. She holds a BA in Community Health from Siena Heights University and an MPH in Community Health from East Stroudsburg University. She has been a certified health education specialist since 2021. Let's connect my conversation with Misozi right now. Well, I say this all the time, but I'm excited because I have another guest on this episode who is a return guest from the podcast. Welcome back, Misozi. How are you?
I'm fine. Thank you. How are you?
I'm good. We spent the last few minutes chatting a little bit and catching up. These episodes are so much fun for me because I get to see and hear from guests that I've interviewed, sometimes from way, way back before the pandemic, like in your case, and then just kind of catch up and see how things are going. And yeah, so tell everyone a little bit about yourself. Let's start there with introductions.
Sure. Thank you again for having me. My name is Misozi Houston, and I am a Master Certified Health Education Specialist with a background in community health education, community engagement, and currently I'm working as a credentialing professional as a project specialist at the credentialing organization here in Pennsylvania.
Nice. We go way back. I remember meeting you in person at a conference, APHEC conference, and you were still a student. You remember that?
I remember that fondly because you had shared tips that I still share today on how to organize my research. So yes, I believe we met in 2018 at the APHA in Georgia.
Yeah, that was so much fun. I remember, so this was very early and the podcast had been like in its first year or just over a year old at that point. And you were listening and you emailed, and at that point I had a very small team. So, and not a whole lot of emails coming in. So I got that one and you said, I'm going to be at the conference. It'd be great if could I just have a minute to meet with you? And I was so excited and impressed with your effort to connect. And I don't know how we found our way to connect in the, 10, 12,000 people that were there.
Yeah.
But we did. And then I think, I want to say every conference, every year since, for the most part, give or take one or two around the pandemic time. But we've been able to see and reconnect since. So it's been fun to watch you grow from student to your career, and seeing you in person and connecting and staying in touch online has been really, really nice.
Yeah, it's been exciting. I've also seen the podcast grow. So congratulations go to you as well.
Oh, thank you. Yeah, I have to look back. I think your previous episode, we think it's like in the 70s in terms of number, right?
Yeah, high 60s or early 70s, around there.
Yeah, so we're like,
and now you're in 300. So that's
right?
Huge. Yes.
So we're like 300 episodes later.
Mm-hmm, mm-hmm.
Love it. Well, let's jump into the journey here because I am excited to kind of catch up and hear about how you're doing. I love the same question that I probably asked you in the previous episode. So if you're listening to this episode right now, don't worry. I will have it figured out by the time I get to the end, and I'll share with you the show notes. We'll make sure you have links to connect and listen to that previous episode as well. But, taking this kind of retrospective view, I like to go back, and kind of fast forward to where we are now. But let's start at the beginning. Like, when did you first learn about or become interested in public health as a career?
Sure. So my introduction to public health was when I was younger. My mother always instilled in us the awareness of people who either lack access to basic needs, for example. And every so often she would take us to a different part of town where we would either be providing services or some goods or supplies to people who lived there. So that was my first unofficial introduction to public health. Initially, I thought I would go into medicine. So in Africa, you're either one of three, you're directly one of three trajectories: engineering, law, or medicine. And upon looking at the different coursework that medicine has, I said, this is not for me. I wanted the non-clinical side and really more that social sciences perspective. So I really became interested in public health and really started volunteering, gotten to know different people and the different career opportunities available in public health. And that was really how I ended up where I am today.
Oh, that's really nice. I often hear about, especially in my case, a lot of folks will just kind of stumble into it somewhere, after or in college. It's like I hear that a lot, but often not even till later. Like in my case, it was much later. It's nice to hear that at least that introduction, early on and kind of understanding it early on. I really think back to some of the work that my mother did, and I think she was in public health and it wasn't really, called public health or a thing, certainly in the area that we were in. But yeah, that's a great story and great introduction. So tell us a little bit about passion areas. So is there a population or a condition or even a public health problem or issue that you are most passionate about?
I found that despite the many roles I've had, I still keep navigating to addressing health disparities, really the underserved communities. It's about empowering these people to either connect them to the resources that they are lacking or really just increasing awareness. Sometimes people are not aware of their resources or the ability to connect to those resources. And really, we just saw the shift in the pandemic, right? Just how many people were lacking those basic needs and how that affected even their access to health. So really just that population, the underserved, low-income population is my area of interest.
And tell us about the work that you're doing. So I can't remember at the time of the interview, I think you were working at, I want to say United Way.
Yes, at a nonprofit doing some community classes. And I pivoted. So I think 2018 was our interview. I think that was the time. But I pivoted 2020. I think everybody pivoted to different roles. And I found myself really doing a lot of awareness, really about risk reduction and also communication. And the work that I did at that time also then led me into this role. Initially, I was a communication specialist, and now I'm in a role of project specialist at the organization I'm with right now.
So tell me a little bit more about what you do, in this role kind of day to day.
Yeah, sure. So in my role day to day, a lot of it is looking at the credential programs that the organization has, and really helping ensure that the organization is meeting its dual accreditation requirements. So a lot of project management, overseeing different requirements and making sure that the organization is not just checking those boxes, but really doing what it says it's going to do.
I have such an appreciation for those types of roles, especially now with, our growing team. That's really vital to have someone that has those skills to be organized and to keep the project moving and to make sure that we're not tripping over ourselves.
Yeah. It takes a great skill. Yeah.
Yeah. Is that very different than what you were doing before?
Yeah. So when I left the nonprofit that I was with, I think the last time we had our interview, I then moved into communications role. So I was basically in communication. And then from there, I got, because of my different, work set and different skills that I brought to the table, when the individual that had this role left for a different opportunity, I was then promoted into the role that I'm in right now. So that did help, just having that communication experience and really just being able to leverage different skills that I brought to the table.
Do you get the opportunity to do a lot of work with, you mentioned earlier, the area or the population that or I guess the thing that you're most passionate about is like addressing disparities. Do you get the opportunity to connect with that kind of passionate work on a regular basis or at all?
So not currently, because I did have a personal matter that was taken care of, but I am looking forward to the summer and beyond because I'll be serving in a volunteer role and be able to provide some insight to the organization that I'll be volunteering. I can't mention it right now. It's not official yet. But yes, I'll be working a little bit more in a kind of a lead role as a volunteer for that.
I like to hear that because I was also catching up with someone else about where they are with their career and so forth. And one of the things that we talked about was how you can be really passionate about a certain area, a certain thing. And it doesn't mean that that is the work that you do full time or all the time. And even in consulting, because she was a consultant, like we think that, oh, this is what I'm focusing on, I'm passionate about. This is only the type of work I'm going to do, but that's not always the case. Sometimes it's a little indirectly connected to what you care about. So, she mentioned the same thing. Sometimes we get a project that crosses our desk at work that is somewhat connected, we can get real excited about. And then sometimes it's just those outside activities in those philanthropic, type of lanes that we run in, and we're able to connect and do that work. So hearing you talk about the volunteering, which is always wonderful, right? It's not just when you're a student looking for a job. It's really it's like how you can show up. right?
Right. Those leadership opportunities and leadership development skills.
Yeah. Great point. So let's talk a little bit about, this is where I call connecting the dots. So when I think about this, and what I'm really meaning is I have a goal, kind of a personal goal here, of helping to, in a sense, normalize some of the terms we use in public health. What is public health really? And it's so vague and broad that it's sometimes hard to conceptualize for people. And then even when it comes to epidemiology, it's like we can Google it or open up an old textbook and get a definition, but what does it really mean? And it means something a little different to everybody, and depending on the situation and how we apply it. So when I have this little segment called Connecting the Dots, it's really so that we can take kind of your perspective, your story, and what you have to share about it, and people hear that. And I think it helps. I get a lot of feedback from people saying that they really like kind of this part of it. So that's my goal and my intention with these questions that seem like rapid fire, but they're really not. So there's two questions. So the first question for you is, how does the understanding of public health help you better serve the community or, the work that you do and have a greater impact?
Sure. So I have a master in public health with a focus in community health education, which helps provide me with a multifaceted understanding of just the different complexities that are available, not just in healthcare, but just really the public health landscape. And there are certain tools that help me with effectively collaborating with different individuals, different industries, or different walks of life to be able to contribute to the broader impact in several ways. So my expertise right now helps me to develop tailored health education messaging. I mentioned earlier that during the pandemic, I had to pivot to really a lot of vaccine outreach, communication awareness, risk reduction kind of information to let people know that these are the issues that are happening. Here's what you can do to kind of mitigate your risk from contracting the COVID-19 disease. And also being able to really connect with those different diverse populations, because just because I learned something one way and was able to educate the community with one avenue doesn't mean that's going to exactly work with a different population. So being able to tailor those different messages based on the population of interest has also been helpful. And also leveraging the different public health frameworks to assess different community needs. And then also, I talked about identifying disparities, which are really important before one decides on an intervention.
Now, in that same vein, the second question is, how does the understanding of epidemiology help you better serve the community and have a greater impact?
Yeah, so definitely, even though something is happening somewhere else, it doesn't exactly mean that it's not going to impact our health in one different part of the either state or world. So my understanding of epidemiology really is the why behind how infections spread, what we can do as public health professionals, and really just educating and advocating for change at the local, regional, and federal level in order to promote health in different areas. This could also mean something as important as voter registration, because that could impact the community's health. Because something as basic as completing the census could mean the difference between a hospital being built in the community to serve multiple needs, or really just having to travel many miles to access healthcare.
I like that question. I like to ask that question and hear how they respond, because, and especially your response, because, it means something a little different for everyone. And we don't want to just crack open a textbook for epidemiology. But you're right. It does help with the why, behind things. So great. Thank you for sharing that. So I'm enjoying our catch up for sure. And I am going to be mindful of time, but I do have another question that I'd like to ask. And it is considering, before I have two questions. So before I get to this is kind of a surprise question, I guess. I didn't plan for it, but I'm just curious, thinking about how your first, time on the podcast, where you were in your career and how, we were engaging at that time to now. What do you think are some of the bigger changes that you've experienced, or like the bigger differences in now versus then that, of course, it feels like I asked this question because everyone that I've brought back so far is like, I'm such a different person. I'm doing something so different. So I just am curious, like, how do you feel? What stands out for you the most in thinking about that interview back then compared to where you are now?
Yeah, thank you for asking that question. It brings back fond memories. So I definitely think I've grown as an individual and as a professional. I think at that time I was just starting, because I was straight out of grad school, just starting this new role after being out of the workforce for a while. And now I am able to easily connect with different stakeholders. I'm not afraid to ask. I think the worst thing that can happen is someone saying no, but at least I'll have asked and been able to take that leap of faith. I'm not afraid to network anymore, which is really important because that's how we grow, right? The role that I'm in right now is all because of networking. And I think that's a really important aspect that some people tend to overlook. Jobs are not just about what you see posted on the website. It's really about who you know and who's been able to put a good word for you.
I love that. Actually, you just probably wrapped up my last question.
Okay.
Because I was going to ask you for any bit of advice that you would share with someone. If you have any more to add, that'd be great. But you just shared some really great advice through your own experience in answering that question.
Yeah, I would share. So for someone, for example, who's looking to do health education, for example, that might be want to consider a certification, could be in project management, could be in different things, or even health education certification. That also could help you grow. And in a pool of many individuals applying for that one job could help you stand out. And then I think I already mentioned networking is a very important and sometimes overlooked resource that everyone could have. You could attend some public health networking in your community, alma mater, just different things like that. Just connect with individuals. And LinkedIn is a great resource for professionals. There are multiple groups, either for females in public health or the American Public Health Association. And this podcast is a really great resource as well, because you highlight different individuals in different industries that are also doing multiple things to promote health.
Yeah, thank you for adding that in too. I think that sometimes people forget that they can connect with our guests, and I'm thinking, maybe I need to mention that more often. I'm not sure. But yeah, it's a great resource because people, especially if they reach out and say, I heard you on this podcast, and then lead in, it's super easy, I think. So yeah great tips.
Yeah, really that relationship building is key because I think a lot of our people that support us in the work that we do, collaboration is key. And you can't have collaboration if you don't have that strong relationship. So building those genuine relationships and partnerships with the people you serve and the people who are in the communities that you want to serve.
That's important. The key there, that relationship. And I think it's easy for us to forget about that or overlook that or assume that someone is not interested or unapproachable or all those things. But if we're not, really striving for that connection, sometimes it's, I'll say this and I won't go on a tangent, I promise. But, sometimes when someone is like connecting, it's like even on LinkedIn, most of the time people still will not put a message there. That's such a missed opportunity.
No. Yeah. If you're listening and you want to reach out to someone on LinkedIn, so brief bio about why you're connecting, who you are, and then the best way to reach you. Don't connect with, just please don't do that.
Yes. That is such an easy thing to do. And you would be surprised. If I have 100 connection requests, I may have 5 that put a message. And that's such a missed opportunity, especially for people that I have a pretty active LinkedIn account now and a lot of followers. And I try to stay, on top of things. But the people that, do take the time to add that message, they stand out. Another thing is it stays in there. It makes it easier when you follow back up with them to have that message right there in the history.
Absolutely.
So it's just a great thing to do. So thank you for sharing those tips and for coming back on the podcast and giving us updates. I really am excited about that and happy that you're here. Well, I hope you enjoyed that conversation as much as we did. Misozi is passionate about health equity and education. I encourage you to connect with her and learn more about the work that she's doing. Make sure you let her know you heard her on this podcast. You can find the links to connect with her on the show notes page for this episode. Now, this episode is episode 361. So just go to phecpodcast.com. Once you're there, navigate to episode 361 and you'll find the show notes and all the links that I mentioned to you earlier. One more thing before we go. Do you know of anyone, student or career professional, who would be interested in learning about the creative and diverse ways that people are leading and serving in public health? Well, please take a moment and share this episode with them. I'm sure they would be interested in hearing the conversation on this episode. If you're listening now in one of the podcast apps, then you can easily share this episode through a text or share it directly to social media. But at the bottom of the show notes page for this episode, you'll also find social media sharing buttons, which make it super easy to share this episode with your network. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening to the Public Health Epidemiology Conversations podcast. Visit phecpodcast.com to find the show notes for each episode and to learn how to work with me.